talk with you about how to administer Gonal-F using the Red Eject pen. If your prescriber has prescribed the Red Eject pen for you, it's very simple to give yourself the injection. When you take the pen out of the packaging, you simply remove the cap, and you'll see a dosing window on the side that tells exactly how much medication is actually in the pen. Next step in preparation is to take one of the needles, and it comes in a little package where you just pull off a tab, and then the needle will screw directly on to the tip of the pen device. Next, you'll dial your dosage, and for today's purposes, we'll say the dose is 150 units. And you just dial that. You see it in the window. No worries if you go beyond it. You can just dial the pen back the other direction. Then take the top off of the needle. There's a big cap first. And then secondly, there's a tiny cap to cover just that tiny little needle. And to administer this, you give it subcutaneously. That means in the fat, generally in the abdomen or the outer part of the thigh. To do this, just choose your site first. If you want to give it in your abdomen, you should go someplace around your belly button, like where these little blue areas are, or either in the outer part of the thigh. Anywhere really that you can pinch an inch. Then you pinch up the area because you want to make sure it's going into fat. You bunch it up a little bit, put the needle straight in all the way, and then depress the plunger. You'll feel it vibrate just a little bit as the medicine goes in. Then release the plunger, wait a couple seconds, and pull the needle straight out. And just like that, you've given the injection. After you've administered it, you want to carefully remove the cap remove the needle by putting the outer cap back on and untwisting it. Then you can dispose of it into a sharps container or protected device. Just drop it in there. If you look in the window after you're done, it'll tell how much medication you have left. And these pens are somewhat overfilled. So just because you've used what you think the total dosage is, take a look in that dosage window because you may have some extra that you can use. Then recap it, and you can place it back on the counter until you're ready for your next injection.